infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the COVID-19 outbreak is spreading and growing rapidly since first seen less than 2 months ago, prompting many governments, including the United States, to ban or significantly restrict travel to and from China. While travel bans are frequently used to stop the spread of emerging infectious diseases, what do we really know about their effectiveness? Well, joining me today to answer this question is Lauren Sauer. Lauren is an assistant professor of emergency medicine at Johns Hopkins University School of Medicine, and she's the director of operations with the university's Office of Critical Event Preparedness and Response. In addition, she's also the co-author of a recent study published in the Journal of Emergency Management addressing this topic. Hi, Lauren. Welcome to the show.
Hey, thanks for having me.
So you and your colleagues, you looked at a number of published articles trying to determine the success of travel bans in mitigating infectious disease outbreaks. However, there's not a lot of stuff out there, is there? And what did you find?
Yeah, there's really not a lot of stuff out there. Our main finding, sort of a spoiler alert, is that we really need more evidence. We need better studies and more studies to better understand how these travel bans impact the global spread of disease. When we started with our initial search through the database, we started with about 16 or 1,700 titles that may or may not inform the study that we did. And by the time we reviewed all those papers and found the ones that actually had information that we could make decisions on, we narrowed it down to 6.
And the 6 of them were not even actual studies of outbreaks. They were simulations. Am I correct?
That's right. All 6 of them were simulations. 5 of them were focused on Ebola, and 1 of them was a simulation focused on SARS. And what this tells me as a researcher is that it's really hard to study the impacts of travel bans and travel restrictions. But it also says that, through the things like the use of technology, through better counting, through better evaluation, it's a place where we really have to start prioritizing.
So why do you think governments turn to travel bans so quickly? I mean, what are they basing this decision on, do you think?
Yeah, I think that a lot of it is based on just doing something that feels like you have an element of control. In emerging infectious disease outbreaks, there's so many unknowns, and we don't have a ton of tools up our sleeve or in our toolkit to mitigate infectious disease outbreaks. And so oftentimes when one feels like it's getting out of control, governments will resort to things like travel bans and mass quarantine to just do something to stop the spread. But what we know is that they don't work in the smaller circumstances. In larger circumstances like what we're seeing right now, they're unprecedented. And so when I say we don't have evidence, it basically means we haven't seen anything on the scale of this, and there's no evidence to support that it would work. Right.
Now, while you determine that the effectiveness of travel bans is basically unknown, you and your colleagues do say that they appear to work in the short term, but not so much in the long term. Can you discuss this?
Yeah, and again, it's based on sort of data from simulations, but basically what we think is happening is that it buys you a little bit of time. So in the beginning of the implementation of something like a travel ban or a travel restriction or even a mass quarantine, we see a sort of a reduction of cases because of the limited spread, but that quickly is erased. And so people may initially limit their movement or may not report their movement, which may have a small amount of space to buy us a little bit of time on that spread of the disease. But we see all the time that people are able to get around these smaller scale travel restrictions, and so we can only imagine that it would happen on larger scale restrictions. And then once they are able to make their way around the travel bans, then spread continues to happen. And I think we saw this on a much larger scale right before the Wuhan travel ban was implemented in Wuhan City. I believe it was the mayor said that he thought that almost 5 million people had sort of managed to circumvent or get out right before the travel ban was implemented.
So in your view, what should we be doing in this policy area?
I think it's important that we have a really good understanding at the country level of the implementation of the international health regulations, which guide our decision-making around travel restrictions and quarantines. And we really need to make policy and implement policy that is the least restrictive on human rights as possible. People do better when their fundamental human rights and their personal liberties are less restricted. And when we are implementing travel restrictions and travel bans, then, like I said earlier, people are going to find ways to move about them, and they're going to try and hide that movement. So we would rather have an understanding of where people are going and why and how, rather than have them try to hide movement.
Yeah, and clearly there's a lot more study that's really needed in this area. And as you said, it's probably very difficult to get anything very useful because of just it's such a massive outbreak. And Lauren, let me just give you one last question and give you an opportunity to talk about anything else in your study that you would like to emphasize.
Yeah, absolutely. I mean, I think that one of the key things that we're learning right now is that when there is no evidence, people will put in policy that may not be safe and may not be effective. So it's really important to encourage data collection, to encourage evidence generation, to try and study this in a meaningful way, even though it's so hard in outbreaks. It's so challenging to have rigorous research methods, to implement analysis in a meaningful way, but all the more reason to do it because it is dramatically affecting people's lives on a daily basis. We're seeing it in action right now.
Well, I'm sure this coronavirus outbreak will be keeping you very busy in coming weeks and months. And for people that want to check out the study, I'll go ahead and post a link to it on the show notes page when I publish the podcast. And I want to thank you, Lauren Sauer, for your time and your expertise. Thank you very much.
No problem. Thanks so much for having me.
You're welcome.